Family caregiving doesn't just take an emotional toll. It can also cost families thousands of dollars each year, with out-of-pocket expenses averaging around $7,000 annually. In this episode, we're joined by Jason Resendez, a national leader in caregiving policy and the president and CEO of the National Alliance for Caregiving. And we're also joined by Johnnie Jones III from the Greater Florida Area Agency on Aging. Together, we explore how policy solutions, including state caregiver tax credits, can help ease the financial strain on working families and better support the millions of Americans providing care. Right now, more than 60 million Americans are providing unpaid care for a family member. And for so many of them, the financial and emotional and physical strain just keeps growing. A new national report even shows that nearly half of caregivers are experiencing serious financial consequences because of their caregiving role. How do we address this growing problem? I'm Maureen Feldman, producer and host of The Care Economy, Practical Approaches to Family Caregiving and Well-Being. Join me for this conversation with Jason Resendez, President and CEO of the National Alliance for Caregiving. Jason is one of the country's leading voices shaping caregiving research, policy, and advocacy. He brings both deep policy expertise and lived experience to his work, so I'm very grateful that he's here with us to help us understand where we are now, what's coming next, and how all of us can make a difference. Jason, welcome. It's really good to have you join us today.
Thanks for having me.
Before we kind of jump into the policy conversation, I'd really love to start on a personal note. I know you grew up in South Texas, I believe, and your mom was a caregiver. So my guess is those early experiences influenced the way you approach your work today.
Yeah, absolutely. It's one of the most powerful things about care is that so many of us have caregiving stories, whether we know it or not. And that certainly was the case with my family. I grew up watching my mom raise 3 kids while working a full-time job and caring for my grandmother who battled multiple chronic conditions, a dynamic all too familiar in Latino households across America and many other households across America. And she provided that care out of a deep sense of love and commitment for her family, but also because she had no other choice. And so that care had consequences. For example, her dreams of becoming a certified public accountant had to take a backseat to her caregiving responsibilities. And that meant that she wasn't able to achieve that dream, and it meant that she had fewer economic opportunities because of the care that she provided. And we didn't know it then, but she was a sandwich caregiver. So she was experiencing the hardships of a broken childcare system at the same time that she was navigating a really fragmented and broken system for care for older adults and people with a serious illness in this country. And so it really is that experience of watching my mom provide that care, the sacrifices that she makes, that I carry into this work. And also 25 years later, as I take on the role of a father to an amazing 3-year-old, I recognize that the care that my mom provided for my grandmother, the care that I provide for my son, is all part of a continuum of care that in whole is underinvested in, underrecognized, and undervalued. And that's why I'm excited about conversations like these.
Well, first of all, that's a beautiful story, and we're really happy that you're here and advocating for family caregivers at such a high level. But to give our listeners context, especially those thinking about caregiving through a financial lens, can you share what the National Alliance for Caregiving does and how your work directly impacts the economic reality of family caregivers?
Absolutely. So the National Alliance for Caregiving is a national system change organization really focused on transforming how we value the contributions of our nation's more than 63 million family caregivers. And we do that through agenda setting research, through policy and advocacy, and through narrative change efforts. And we are really founded on the simple idea that in order to build support and investment for family caregivers, we have to have the data and the evidence to support those investments, to empower advocates and decision makers with data and with stories to champion those investments. And that's where our marquee research project was born, Caregiving in the U.S., which is an ongoing snapshot about family caregivers, their challenges, the financial realities of care, the financial impacts of care, the healthcare impacts of care, the impacts of care at work.
Yeah.
We've been measuring and documenting the experiences of family caregivers since the 1990s. So it really is that data that has enabled us to, as an organization, champion economic policies like paid family and medical leave, like caregiver tax credits, and also to empower our partners with that data in order to champion that kind of policy change when it comes to financial opportunity.
Well, speaking of the data, that because it is important, because without it, we can't really make these policy shifts. Based on the report, what are the most important findings that a professional who's supporting family caregivers, should understand about the current financial and economic state of caregiving? What did the report reveal about where caregivers are financially today?
So we learned a lot from this report. We always learn a lot every 5 years. But what's unique about it is we're able to track over time how things have shifted. And what we saw in 2025 was one, just the growth of the population of family caregivers. We're talking about 63 million Americans, nearly 1 in 4 Americans demanding care for someone living with a disability, who's aging, or with a serious illness. That's a nearly 50% increase from 2015. It means there's more people providing care in this country than the population of the state of California. So that's a huge community. And really, we see that as the floor, not the ceiling of who family caregivers are. And so that prevalence, really shapes a lot of the realities. There's a sheer number of people experiencing and navigating care. And what we see is that experience over time has become more intense. So more than 60% of family caregivers are in high intensity situations. And we measure that by the number of activities of daily living they support a week, the number of hours that they provide a week. And we also see that the duration of care has increased. So about 1 in 3 family caregivers have been providing care for 5 years or longer. And that's up from 2015. And so it's becoming more prevalent, it's becoming more intense, and it's lasting longer. And so as a result, we see some really interesting and acute impacts, particularly when it comes to financial well-being. So according to our data, that financial experience of family caregivers includes, that more than 1 in 2, or about 1 in 2, experience at least one negative financial impact due to caregiving. And so what does that mean? What is a negative financial impact? What is that? What it means is that family caregivers are stopping savings in order to provide care. So folks are not putting money into 401k accounts. They're not planning for their children's educations. That money is going into providing care, to making ends meet. Because one of the other things that we see is that a huge number of family caregivers are reporting affordability challenges. It's hard to find affordable services in their communities when it comes to basic necessities, but also when it comes to things like care supports. And so that affordability challenge is really intersecting with these issues and creating these negative impacts. But we also see family caregivers taking out things like high interest rate loans and credit cards in order to provide care. So there are a number of financial realities that shape the care experience that need to be addressed either through programmatic initiatives or through policy initiatives.
I was so, not shocked. I work with family caregivers all the time and have for the last 6 years pretty intensely. But really, when the report showed that nearly half of them experienced significant financial strain, also, you just laid out really what happens to families and communities when those challenges don't go addressed. It perpetuates a circle of financial instability. If you have to retire early or take time off work and miss opportunities to advance or quit completely, that's leaving the next generation of very vulnerable. Which moves me now. Let's move on. The report was really interesting in the way it highlighted the differences in the states, what caregivers in one state experience across state lines. So where are the inequities? Where do they show up, and what do they mean for caregivers' economic stability?
What was there are many exciting things about the report for data nerds and for folks, who are service providers and really rely on data. But one of the exciting developments of caregiving in the US 2025 is that we provided state level cuts and analysis of the data for the first time. And we'll continue to do this, over time moving forward. And what that enables us to do is to see how the experience of family caregiving is different state by state. And what we saw is that obviously state policy decisions, the state infrastructure shape how easy it is to provide care in this country. It is especially true when it comes to financial impact.
You're just for clarity, I don't want to interrupt you, but just for clarity, you're saying that the states are really where determines impact?
Well, it all intersects together, right?
Okay.
I mean, like states are impacted by federal decisions and federal resources, but certainly state level decisions play a big part in shaping how hard it is or how easy it is to provide care. There's no number one driver of these issues, but it's helpful to understand, what are the differences state by
Yeah.
state. And what we saw in our data was, every state has financial strain when it comes to caregiving, right? But it's about, intensity of that strain. And we saw in places like Minnesota, 34% of family caregivers report financial impacts in Minnesota compared to nearly 60% in Georgia.
Oh, that's a big
That's a
difference.
big difference,
Big
right?
difference, yeah.
Exactly. And so we start thinking about what are the differences between a state like Minnesota and Georgia. Obviously there's some demographic differences, that's important to recognize, but there's also infrastructure differences. Minnesota has a paid family and medical leave policy. Georgia doesn't. There are many policy issues at play that impact the caregiving reality, and that creates opportunities, right? It creates opportunities for states to make investments to help improve the financial outlook of the family caregivers in their communities, particularly those states that have a high prevalence of family caregivers. And that was the other thing that we found, is that there are some states that have a much higher prevalence of family caregiving than other states. And so we see family caregiving really clustered in the American South in places like Mississippi, Georgia, Louisiana. So there's an opportunity for those states who have that high prevalence to make decisions to support family caregivers through things like economic policy, like caregiver tax credits.
So that brings me to this question. Certain federal and state policy levers do exist, but are there specific ones that are helping caregivers protect their financial well-being that are in progress, that maybe are slow to catch on, or that might be misunderstood, that the AAAs or the professionals who are listening could learn more about, maybe get more familiar with, that we should highlight?
So there are a number of economic and policy levers that states can leverage to make caregiving less hard in their communities, right? That's really the goal here. It's like caregiving isn't easy for anybody, but it's less hard for some. And so when we think about what those policy options are, I really want to give a shout out to our partners at AARP who have created a long-term services and supports scorecard, which breaks down policy options at the state level for supportive family caregivers and also older adults. And those include things like paid family and medical leave, right? Recognize that over 60% of family caregivers are providing care while working. And because of a lack of support for those working caregivers, they're often going into work late. They're passing up promotions. They're having to change schedules. And that impacts not just the caregiver, but it impacts the ability for, businesses to grow and to thrive. And so really thinking about what policies can be in place at the state level that help employed caregivers continue to provide the care that they need to provide, but also continue to work to add to the, their economic mobility and to the economic mobility of businesses and communities and states. And so
Mhm.
paid family and medical leave is a great example. Paid
Mhm.
sick days, another great example. Caregiver tax credits, right?
Mhm.
Caregiving is extremely expensive. A conservative number is that family caregivers spend out of pocket about $7,000 annually when it comes to care expenses. That's a very conservative number, I would say. And that is non-tax deductible. I think about my family. My husband's a teacher. When he is going and spending out of pocket for school supplies, many of those expenses we can deduct on our taxes, and that's not the case for any kind of caregiving expenses that we might incur. And so some states are passing caregiver tax credits in order to help reduce the out-of-pocket burden that caregiving sometimes represents for families. And so these are all great examples of
Yeah.
policies to get aware of. But I think one of the main things that AAAs can do as it relates to these issues is to think about what services are you providing around financial planning and navigation, right?
Mhm.
So thinking about caregiving both as, yes, let's help people understand the social services available to them and support around training around things like activity of daily living and that
Mhm.
medical and nursing tasks. But it's also think about the financial navigation and financial wellness support and planning support that, caregivers would benefit from because
Yeah.
of these impacts that care has on families and the economy.
So let's take a breath right here, right now. We've been talking about financial policy solutions. You mentioned things like tax credits, paid caregiver leave, benefit coordination, and even income protection. These all seem very promising right now. And as a AAA, I'm familiar. Several AAAs do have incredible programs, whether that is financial or legal. Toolkits, just guidelines, helping them support them. So, how can AAAs and professionals help caregivers actually use these tools in real life? Because I know our listeners, they're saying this all sounds great. And yes, I've heard about it. How do we best support the families out there? You also mentioned it's different state to state. So, I understand some AAAs are smaller and, not every state has the same resources. So, if we're talking about financial stability and access to support, even without major funding, how can we support those smaller states and those AAAs to have more impact?
Yeah, absolutely. I think number one is recognizing that family caregivers are this distinct community and population, right? One of the great things
Yeah.
about the aging network is the, vital importance of the National Family Caregiver Support Program. So
Hmm.
there's already infrastructure specifically around caregiving. So as we think about programs delivered through the aging network and the great, financial assistance and education, making sure that AAAs are doing things like tailoring content specifically for family caregivers. I think that's, a low hanging fruit opportunity
Hmm.
to ensure that family caregivers, are being seen, right? That they're not getting a module or
Right.
education that not doesn't speak to their circumstance and to who they are and their situation. So I think that tailoring for caregivers is really critical.
Yeah.
And then two, one of the things that we've seen in our research and also we hear from caregivers is the importance of assessments. I know
Mm.
this is sometimes hard because we don't want to overburden family caregivers and clients with, paperwork. But assessing family caregivers for their needs, right, and for their financial wellness
Right.
needs and educational needs can help to ensure that you're referring them to the appropriate places for support. And in our
Yeah.
research, we actually saw that family caregivers want to be asked these questions if it
Mhm.
leads to meaningful support. So I think that, family caregivers are willing to spend an extra 20 minutes to take a survey or an assessment if it's going to lead to meaningful
Mhm.
support. And
Mhm.
so I think that's another, tool in the toolbox. And then last thing I'll say is, to understand in your communities who's already doing this work, what other financial resources, navigational resources exist in your communities, and how are you partnering with those resources and maybe their organizations or private sector solutions related to financial wellness? Because I don't expect, and I don't think we expect in all AAAs to be financial wellness experts, right?
Right.
That's in so many ways outside their wheelhouse. But, how can you serve as a hub and a connector to experts and organizations that can help provide that kind of support?
And that's great advice. And that's one of the reasons why podcasts like this exist. We are learning that many of the AAAs have really comprehensive programs. They support the family caregivers, they are easily accessible, and they can translate into multiple languages, but not everyone else knows about them. So by distributing podcasts like this and normalizing this conversation, I think it might be easier for some of those family caregivers to seek some of those support resources that already exist. And of course, most of the AAAs have told me that they're free and scalable and can be shared easily. So let's move on to programs that compensate family caregivers, particularly through Medicaid or HCBS, self-direction. They're starting to gain some attention. And I wanted to ask you, at your level, how important are these models for caregivers' financial survival? And, what policy barriers might they need to overcome to scale them responsibly? Because we talk about it a lot, but I'd like to have you break it down for us.
Yeah, absolutely. So this is a really critical policy option for states and also the federal government to respond to a number of challenges that family caregivers experience. And one of those challenges is the lack of access to affordable services, including paid support from direct care workers is a great example. And so we know through the pandemic, for example, really exacerbated the direct care workforce shortage that exists in this country. This is, I think, a reality that we've been dealing with for many years now, and it only got worse during the pandemic. And so that means family caregivers are struggling to get the support that they need to help provide care, that individuals who want to stay and age in their homes or receive care in their homes are finding that difficult to do because they don't have access to direct care workers or paid support. And so one of the responses to that has been states strengthening their self-direction program so that family members can step in and play the role that a direct care worker has played and get paid for that. It's hard, or there's a shortage. And so that's been really key from a workforce issue. And so that's really how we think about this is a really key workforce issue that states can leverage in order to support aging in place and receiving care in place and in communities. We also know that family caregivers, when it comes to valuing their contributions, we know in our Caregiving in the U.S. 2025 that over half say that they want forms of direct payment in order to provide and shoulder their care responsibilities, because it speaks to what we value and also speaks to the work that they're providing in support of their family members or loved ones, people in their communities. And so it's something that family caregivers want. So self-direction and self-directed programs are really key for supporting family caregivers to take on that additional work, but then also to help bridge these gaps that are caused by a shortage of direct care workers. And the great thing about self-direction, it's almost in every state has a form of a self-direction program. There are a lot of barriers to that in terms of, eligibility, in terms of funding. During the pandemic, we saw a big increase in funding available for states to innovate when it came to direct payment programs. Starting to see, as funding has gone down, we're starting to see states, grapple with that reality. But some states are expanding, and thinking about those programs differently. Vermont is a great example, introducing new payment mechanisms. New Mexico, another, really embedding that within their home and community-based service playbooks in order to support the growing demands being placed on families and family caregivers.
Well, I'm going to circle back to a couple of things. I definitely want to talk to you about, the role of private platforms in a minute. But before we move on to that, we've talked about the caregivers balancing work and care at a great financial cost. And, so I wanted to ask you what emerging workplace policy shows the most promise for protecting caregivers' income and employment? And not so much at this moment, but how should employers prepare over the next 5 to 10 years? And then, so before you jump onto that one, the next question I'm going to talk to you about that is about those private platforms, Clio, Trualta. There's some other ones that provide coaching, navigation. So let's take the first part of the question first, and then we'll get to those private platforms next.
It's really important for employers to step up in supporting their employees who are balancing both care and work. We know from our data that that is a large number of caregivers who are navigating both those responsibilities. And so we really see this as an opportunity for employers to stay competitive, right? Employers want to retain their employees, and their employees increasingly are experiencing caregiving responsibilities. And so that creates a big opportunity for employers to step up and differentiate themselves and to retain and to grow those partnerships with employees around caregiving. And I think more and more employers are starting to recognize that. That was one of the key trends that we saw in caregiving in the US 2025 was the dramatic increase in employer-based supports for family caregivers, whether that was paid family and medical leave, flexible work schedules, caregiver coaching and support services like the ones we'll talk about a little later, to other benefits designed to support, family caregivers. More and more employees are able to access those kinds of supports. And we also see that as a result of, state policy decisions. So paid family and medical leave, for example. One, we see some employers, particularly as it relates to the pandemic, started to expand, even without federal level policy in place, paid family and medical leave policies, but also states. Over 13 states have now established a paid family and medical leave policy. So employers in those states need to mandate. That's how I was able to take paid leave when I first started the National Alliance for Caregiving and welcomed our son to the world, was because the District of Columbia is one of those districts that has a paid family and medical leave policy. Really, employers are starting to recognize the importance of care. They're starting to innovate in providing those supports, but then also state policymakers are recognizing that intersection and advancing policy at the same time.
Mm-hmm. Well, we're going to talk about low income and no benefit caregivers in the coming up moments here, people that don't work and don't have access to those benefits. But let's wind up this portion of it by talking about the role of those private platforms. So Clio, which you can, I think, are working with, you can talk about how they are supporting employers, but also you had mentioned, people want to get paid for their caregiving, and there are platforms like Trualta that help provide that coaching and that navigation. So, and what this will do is help their economic situation. So how do these private solutions fit into the broader effort to improve the financial and care stability? And where does the public policy need to catch up?
So more and more innovative services are emerging to help both family caregivers navigate their challenges of care, whether that's understanding if you're eligible for a payment program, whether you're eligible for certain benefits. So companies, like you mentioned, Trualta, there's other companies like RubyWell and Italy who really emerged to help family caregivers understand, what do I have access? What am I eligible for? And then walk them through that process. And that might look like in RubyWell's example, here's how I can overcome the obstacles for direct payment through the Medicare program and be a paid caregiver. And so there's great examples of the private sector stepping up to fill that navigation gap. And then you have innovators like Clio, who are recognizing that employers want to be part of the solution when it comes to supporting caregivers, and are partnering with employers to help them offer benefits to their employees to navigate the care challenges that they're often seeing. So that's things like coaching
Yeah.
and navigation. And it's really great to see both direct to consumer options and then also employer based options. And that really speaks to the market opportunity, right? The podcast is called The Care Economy, right? Sort of this is a huge market opportunity. 63 million Americans. Again, that's the floor, not the ceiling. So that, market is actually much bigger. And so companies are in the private sector starting to recognize that opportunity. And that's a really exciting because it takes everybody. It's not just a policy issue. It's not
Yeah.
just a programming issue. It's not just an aging issue. It's a whole of society issue. And so I'm starting to
Yeah.
see a whole of a society response being put in
Mhm.
place.
It feels, some of these role of private platforms are recognizing this is a growing issue. It's not just impacting individuals who are hands-on caregiving, but, again, the communities, the business, the income, how much economic stability people have. So we're going to be inviting on Johnnie Jones from Florida AAA in just a minute. But I have one last question for you before we wind it up, and that has to do with the low income and no benefit caregivers. So, gig workers, hourly workers, those with limited income, or some people have no employee benefits at all. What does it mean economically when a caregiver support is tied to employment? And how can policy expand to access financial stability so it isn't determined by a job type? So if you're working and, those employers are creating policies for you, that sounds great. But what does everyone else do? And how can the AAAs and professionals who are supporting them help lift up those individuals?
This is a really critical issue. When we've seen so much progress, right? We've seen a growth and challenges, certainly when we look at our data, but we've also seen progress. And the employer progress is a great example of that. But what we've seen is that there are big disparities in who has access to those supports. And hourly workers, for example, have the lowest levels of access to those employer-based supports compared to salaried employees. And so while it's great to see employers step up, there's still a huge need for policy at the state and federal level to create a basic infrastructure, right? Employers can't do this alone. There needs to be a partnership between states, the federal government, and the private sector in order to support family caregivers. And we don't have that in place right now. So as a result, like I said, hourly workers experience higher financial impacts, low income family caregivers who are making $50,000 or less at the household level are more likely to experience more than one negative financial impact due to caregiving. They're more likely to be in high intensity care situations. They're more likely to experience emotional distress, and that intersects with a lot of other inequities as well. So there's a real urgent need for state level and federal level solutions so that there is a backstop, right? Not everyone can work in a corporate job at, financial services firm, and you're going to have great, caregiver benefits. There needs to be a baseline level of support for care because care is one of those issues that we all benefit from. Right.
Right.
It's an issue that employers really benefit from. And so we have to have a basic infrastructure in place to support and address the negative financial impacts of care.
Well, thank you. I mean, that makes a lot of sense. And that's why we're so happy people like you, Jason, who understand caregiving from a personal experience. And you're obviously very good at what you do, research and policy, and you're using data and real life experiences to push this agenda out there so we can all understand it, but also so we can do something about it. And that is why I'm really excited. And welcome, Johnnie Jones. Johnnie Jones is the Caregiver Support Coordinator, coordinating caregiving training and support at Elder Options, and that's the Mid-Florida Area Agency on Aging. And Johnny, I think, serves 16 counties, including one of the nation's largest retirement communities, and that's the Villages. I think currently Johnny and his team offer 3 evidence-based interventions for caregivers. And the team recently received an ACL grant to develop capacity to serve caregivers using community health worker models. So, Johnny, I'm really happy to have you here because you have also some policy experience, but you had said something to me about the communities you serve, everything from some of the wealthiest retirees to some of the most in need that live in some of the rural parts of Florida. So I know Johnny has some questions for you, Jason. And Johnny, if you want to tell us just even a little bit more about who you serve, that would be, I think, setting the stage for this conversation.
Absolutely. Thank you so much for having me, Maureen, and thank you for the excellent discussion so far with you, Jason. I've really gained such an insight and taken quite a few notes from that thus far. We are probably one of the most diverse PSAs in the state of Florida. And I am privileged to serve, from farmhouses to penthouses. And it is really quite a diverse area. And much of many of the issues that we've heard discussed here today are the things that my caregivers, the caregivers that I serve and care so much for, are dealing with. And so I wanted to ask you, from your vantage point, it seems that you're really talking about the impact of financial strain on the caregivers, destabilizing forces in the caregiving journey, especially among the people that I serve in my smaller rural communities. From your standpoint, what practical approaches should AAAs like ours be championing right now to help prevent family caregivers from sliding even further into long-term financial crisis?
Absolutely. Well, I really appreciate, Johnny, the opportunity to share a platform with you. Big admirer of your work and
Thank
how
you.
challenging it is. So I think there are a number of practical things that AAAs can do to address these issues. I think one is thinking about, different ways to meet caregivers where they are. So I love this approach around community health worker integration. So how do we better integrate caregivers into care through community linkages? So partnering with existing infrastructure like community health workers, I think is a great example. I think we talked about some around how do we better integrate financial education and navigation, and think about that in relation to referral partnerships and community partnerships with organizations who might be better positioned to provide those kinds of supports and services. And then I think third is the importance of public-private partnerships. So thinking about opportunities locally for the private sector to play a role in delivering those services and supports when it comes to financial education and wellness. Really thinking about where are there opportunities for innovative partnerships between the Small Business Administration or local financial services institutions or local community colleges and universities. I think there are a number of opportunities to think about, where can there be outside the box partnerships to help supplement, what I know is a really lean and mean service infrastructure when it comes to aging and caregiver support. So I think it really comes down to how do we divide and conquer and amplify through partnership.
Jason, I really wanted to, as a follow-up to that, especially, who should we be watching right now? You have a national vantage point. What states or regions are doing innovative, creative things that might be able to be replicated or scaled, and maybe even fine-tune that a little bit to regions and sizes and what would work? Because I know that we would have a national audience here. We have a national audience. We want to make sure that we're addressing more than just my region, the southern region. What right now, who should we be looking at?
Absolutely. Well, I think we should keep following you, I think, to start, right? I think the opportunity to better expand the infrastructure of support for family caregivers, through the healthcare system, I think is really critical. I think one of the things that we see in our data is that the majority of family caregivers are one, sure, helping with things like activities of daily living, but they're going beyond that and are an extension of the healthcare workforce. And so when we see states like Florida starting to develop community health worker approaches to engaging and supporting family caregiver, I think that goes a long way in leveraging and recognizing the healthcare infrastructure that exists and can be leveraged to better support family caregivers and better integrate family caregivers into that infrastructure. And we're seeing policy catch up, right? We're seeing policy catch up in terms of reimbursement for community health workers. And so I think it's really smart to think about how to build on that pathway, but also reimbursement for healthcare providers to train family caregivers through the Medicare program. And so we're seeing states like Pennsylvania really think about how to better integrate family caregivers and the aging network into healthcare delivery through community care partnerships. So that healthcare, I think, infrastructure and partnerships is something really key to look at. And Florida and Pennsylvania and other states are I think, doing really great work there. I think we have states like New Mexico doing really interesting work to look at care across the care continuum, right? We see that family caregivers, over 16 million are providing care for both children alongside providing care for an older adult or someone with a serious illness in their life. And you have states like New Mexico who are doing work both on the childcare side by making childcare more accessible and affordable, while at the same time introducing more supports for family caregivers supporting older adults through things like training and direct financial assistance. They just launched earlier this year MexiCares, which provides structured training and financial assistance to family caregivers. And what's so innovative about their approach, again, is that they're thinking about it across the care continuum, and they're linking that support between care for children and care for older adults. And I think that really is the future. Folks are experts and have expertise in infrastructure, usually on one side of that spectrum, but anywhere we can create partnerships and linkages across that spectrum is going to strengthen supports and services for family caregivers who often go unseen and unsupported.
That's a great answer. And I also wanted to ask Johnnie to highlight something. We are doing an episode also on the legal aspects of financial caregiving. And we found that so many of the caregivers don't have the proper forms in place. They don't have the legal right to make certain decisions. And they often use their own funds or use the person that they're caring for's funds not in the best way. So, Johnnie, why don't you share with us what you're doing for your community? I think it's really powerful.
Absolutely. Thank you for that opportunity. As I heard Jason say earlier, caregiving is becoming more prevalent, more intense, and it obviously is a longer duration. We're in a situation right now where we are seeing caregiving become a bigger and more impactful issue. So in doing that, what we have done is tried to respond to what caregivers say they need from us, other than education around those things that you mentioned earlier. And so we have found that one of our most popular programs is to partner with private elder law attorneys in and around our community in the 16 counties that we serve to do free legal clinics and symposiums, legal seminars. We've called them multiple things, and we do them both in person and also in hybrid and virtual formats to try to reach as many caregivers as possible. In order to streamline that, and so that the attorneys are comfortable, we make sure that the information that is being shared is generic enough that that they're not delving too deep into their own personal situations. but they are highly informative. The caregivers are able to leave those at least equipped with planning tools, what's on the horizon, what they should expect, what they need to begin to address. So I think it goes hand in hand with everything that we're discussing as it relates to financial planning and preparation. They also have to incorporate that legal piece. And so we are going to further expand that. We have multiple of those events planned for the 2026 calendar year, and we are expanding on that this year by taking it a little bit deeper into a more of a clinic format where we will actually see some reduced rate and even pro bono assistance to some of those caregivers that come in, again, due to that partnership.
That's impressive, very impressive. And Johnny, are those the collateral that you create? Obviously, legal aspects are changed state to state. There are some laws state to state, but there are some generalities. Is this something that other AAAs might be able to learn from you or access? And maybe if they reach out to you, can you share your template?
Absolutely. We'd be happy to share the format, the subject matter, the evaluations, the things that we've received, and it is absolutely able to be replicated because again, it is such a general and prevalent issue, and we really would love to share. We many times record those events, and we also make them available to people outside of the state of Florida. So
great.
the only thing that they would need to keep in mind is that some of the issues discussed may be Florida specific,
Right.
but for the most part, they are things that we will see as national issues. And so we would be ecstatic to share that information with anyone who would reach out.
Thank you. And that is a gift. So any AAAs or professionals listening, please contact Johnnie Jones, and we'll make sure we link all of the resources we share today in the show notes, along with the Caregiving in the U.S. research report that Jason worked on. But we also did a podcast and will be making it available on the legal issues, also generic across the states. We address care contracts. We address, whether you should have your name on your mother's checking account, the legal aspects of that. Some of the beliefs that we have that are just simple family dynamics turn out to be legal concerns if they're not done properly. So I highly recommend that you check out the AAA workshops or programs, episodes.
Typically elder law seminars or elder law panels.
Excellent. Elder law seminars or panels, and then we'll also make our podcasts available. But before we wind up today, this has been a really interesting conversation and hopefully informative for our listeners. But I'd like to look ahead at the future of caregiving policy, Jason. And if you were to look ahead 5 to 10 years, how do you see caregiving policy evolving in ways that are meaningfully able to improve caregivers' economic security? So I know it's hard to project 5 to 10 years, but would love to see if you have an eye on that.
Yeah, absolutely. And I just have to say, I love that model, Johnny, and I think that there's such a great opportunity to take that framework and apply things like financial planning. We hear from so many family caregivers who have turned into certified financial planners because of their caregiving experience, and to be able to take that same kind of approach, I think would be really fascinating. So you had a light bulb go off in my head with your model. So
great.
excited about that. And in terms of where I see policy over the next 5 years for family care, I think this is a great, we're so excited to be able to share the platform with Johnny and Florida, because I really do see it's going to be a state stepping up. Because they are feeling, first line of defense in the impacts that our growing care crisis represents for families and communities. And so they are going to be the ones who are stepping up and responding as we continue to experience, I think, gridlock at the federal level. And we've already started to see that. We've seen a proliferation of paid family and medical leave policies at the state level. We've seen more and more states across the political spectrum pass things like caregiver tax credits. We're seeing more states, innovate at the state level in terms of like new funding mechanisms for caregiver supports. States like Texas, who've just established a big state fund for Alzheimer's research and caregiving support. So states are really starting to step up and innovate because they're feeling the pressure of the growing demand for care and for supporting family caregivers. So that creates a lot of opportunities for state-based partners and advocates to help shape that future. And I think it's exciting. It's a really challenging time, but progress is being made every day, every week, because caregiving, doesn't stop. It continues to grow. I'm excited to see where we'll be in 5 years based off of, the momentum that we've seen in several states.
Well, for our listeners, who are a lot of them already serve our caregiver community, professionals, AAAs, and even caregivers themselves who want to strengthen the caregiving system. This is the last questions I have for you. What are the most powerful ways that they can engage to improve the financial outcomes and influence the policy? So you gave us the projection. So how can our listeners get involved, and how can they help support moving this policy forward?
Yeah, well, I think one on the AAA side to form connections around great ideas like the programs coming out of Florida. I think that's a really important role for service providers to play, is to think about, what am I doing to meet those financial challenges that my clients are facing, that family caregivers in my communities are facing. And so I think that's one from a family caregiver perspective. I think it's, sharing your story, right? Really thinking about and recognizing that you're part of a much bigger community, even though caregiving can be extremely isolating. And the financial challenges only contribute to that. You're one of at least 63 million Americans navigating this challenge. So you're not alone, and your story can really drive change. And so often the financial aspects of care are, go untold. And so really helping policymakers at the state and federal level understand, not just the health challenges that you've experienced, but also the financial challenges that you've experienced. It's often, when issues become pocketbook issues is when they start to get addressed. And so the more that we can do around sharing those stories can help us to create that change that we need and support for programs that can help address them.
Well, as you know, from doing this as long as you have, and you, Johnnie, I'm sure everyone has a story. We are either caregivers or we know a caregiver. So I appreciate that you encourage people to talk about it, to normalize it. The economic challenges are very, very real. And this conversation, Jason, gives me hope that you have private companies that are creating platforms. That's because they recognize not just a need, but there's an opportunity for them there. So states and federal policies also looking for ways to increase the way they support family caregivers. Wisconsin's AAA has a care kit that they help to inform employers how to better support family caregivers. We have an episode on workforce policies and how employers can take the lead here and help support family caregivers. And I'm very happy that you addressed those that aren't working at all, what they can do, how they can find support, how they can create more stability for themselves economically while caring for their loved ones. So I really appreciate both of your time and your expertise, what you're doing. I would love for all of our listeners to check out the report that we've been referring to, Caregiving in the U.S. research report that Jason has referred to, the National Alliance for Caregiving in partnership with AARP. More attention is being focused on this issue, and people like you who bring it out every day in what you do. It makes a huge difference. So I really want to thank our guests for sharing their knowledge with us, for taking the time, and I hope that you check out those resources. Everything we spoke about today will be linked in the show notes, and you can find us on YouTube or wherever you find your podcasts. And if you want any additional information, you'll be able to reach Jason or Johnnie, and their contact information will be in the show notes as well. So please join us next time. This is The Care Economy, and we are looking forward to our next opportunity to speak with you. Today's conversation made one thing clear: family caregiving doesn't happen in a vacuum. Our local, state, and federal policies play a crucial and real role in shaping whether caregivers remain financially stable or are pushed towards crisis. My thanks to our guest, Johnnie Jones from Mid-Florida's Area Agency on Aging, and to Jason Resendez, President and CEO of the National Alliance for Caregiving, for sharing their experience and insight with us. These are exactly the kinds of conversations that help move caregiving policy forward, not just in theory, but in practice. The Care Economy podcast was made possible by the University of Southern California's Center for Advancing Family, Caregiver, Financial, and Workplace Security, with funding from an Administration for Community Living grant. For more information about our guests, including links to resources, tools, and any references mentioned in today's discussion, visit our show notes or our website, and find this episode on YouTube or wherever you find your podcasts. We want to remind everyone that the views and opinions expressed in this program are those of the speaker and do not necessarily reflect the views or positions of the University of Southern California, the Administration for Community Living, or any entities they represent. And finally, to our audience, thank you for listening and for being part of the effort to strengthen the systems that support family caregivers.